Our job at Texans Together is to get kids home. That's the only thing that we do at Texans Together. We provide the services, we build the network, we do the other things, but primarily we only do one thing. We stay focused on getting kids back home. And we do that by keeping kids safe and focusing on their well-being.
Welcome to the Riverside Project podcast. We are mobilizing Houston to empower families and transform generations. We hope these conversations will give you a greater understanding of the issues facing our community and inspire you to find your place along the river. Thank you, Shaundricka and Brock, for being on the podcast today. We're so glad to have you.
Thank you.
Yeah.
Thank you for having us.
Of course. Well, just to start us off, as we do every episode, share a little bit about who you are and how you came into this role outside of your bios. What makes you passionate about this work, and how did you get here to leading Texans Together?
Sure. When I was in college, I felt like I wanted to teach, but then I wasn't really connected to it. I wasn't as passionate about it. And so I really, spent some time finding myself. I worked at a residential treatment center, and I really connected with those kids. I learned so much about those kids and myself. And a lot of those kids were in custody at the time. And so I was very curious about how they got there, why they were there. And so I applied to be a caseworker. And at first I was like, this will just be, just another job. But I just became so connected to the work. And here I am 16 years later. I've met so many kids, so many families that I'm still connected to that really drive my passion. They continue to create a sense of urgency to make sure that they're connected and taken care of while navigating the system.
Yeah. And for, maybe listeners who have been following the podcast for a long time, we were just talking that you are, or saying that you are the first returning guest to this podcast. You previously were on an episode from your role in DFPS, and now have switched over to Texans Together. So welcome back to the Riverside Project podcast.
Thank you.
Yeah. Brock, tell us a little bit about who you are and how you ended up in this role.
Well, thank you, Amber. And I want to say Shaun was the first Texan together, and I was the second one. So we were the first two Texans together. So it's not unusual for Shaun to be leading the pack. That's for sure.
Yeah, I believe it.
I got into this business, early in my career. I was an academician. I was at Dalhousie University, and we were running large epidemiological studies for adolescents and studying at-risk behavior. And these were government-funded projects. And so this was in Canada, where we have socialized medicine. And in Canada, we had a nice program where university academics could meet with policymakers and parliament officials to really have some genuine input into how policy is made around health policy. And I really enjoyed that work at the time, but like I say, it was in Canada, and I'm a small town Texas boy, and I wanted to come back home. And so the first job I found was with Child Protective Services, and I felt like in the role as the analytics and evaluation team lead, I would be able to do the same sort of work I was doing before, working with policymakers in child welfare, and that's how it started out. And so I took my first job there, and I've been with them. I was with them for about 16 years, and it really turned into something nice for all of us. And like Shaun, I don't know that I went into it as a permanent position, but this kind of work really grows on you when you understand the gravity of it and the great need for it. And it does take a lot of time from your own family, but I remember when my kids were little, they'd ask me, what do you do, Daddy? And I'd say, I look after all the young kids in Texas whose parents need some help looking after them, baby. And, even a 4-year-old can understand that.
Yeah, absolutely. Well, tell us a little bit about Texans Together. So people in our community know DePelchin very, very well. Have been around for over 130 years, I believe. it's a household name in our community. And now Texans Together is new, but attached to DePelchin. So share a little bit about this idea of community-based care. So that's how Texans Together came to be. But for listeners who may not know a ton about what community-based care means, can you share a little bit about what that is and then why Texans Together became a thing?
Well, I'll try.
We know it's complicated.
Community-based care is, I think, in its application, it's a legislative mandate. The legislature creates state agencies, and they created the Department of Family Protective Services, part of which is Child Protective Services. And they fund these agencies, and they lay out the mandates, and they tell you how to complete that work a lot of the time. And in this case, they've decided to move direct service delivery into subcontracts across the state. And so each catchment area across the state is competitively bid by nonprofits who have experience in child welfare. And the state decides in those competitive contracts, procurements, who gets signed. And that moves Child Protective Services, as funded through the state, to be a contractor, a procurer of direct service delivery. And so that's how Texans Together became Texans Together. I believe DePelchin put in the contract, and then they created a second nonprofit called Texans Together, and so that's how we got the contract. And our job at Texans Together is to get kids home. That's the only thing that we do at Texans Together. We provide the services, we build the network, we do the other things, but primarily we only do one thing. We stay focused on getting kids back home. And we do that by keeping kids safe and focusing on their well-being.
Yeah, that's a great way to put it. How would you say, Shaundricka, just from the how the system was set up previously to how it is now on the day-to-day, what kind of shifts? What is it? What's really changing when it comes to kind of how this is delivered? Does that make sense?
Yeah. So in stage one, like Brock said, we really wanted to focus on safety and child well-being. And so our teams are structured in a way that we are looking for paid placements for children in stage one, but we're also looking for non-paid placements. We have a family finding team that when we get an emergency removal, we immediately dig into that case to try to find a family member to connect those kids to family and friends and people that look like them so that they feel safe. Those are some of the things that we think are unique to stage one. The other thing that is unique to stage one is we recognize that kids tend to cycle in and out of placements, and we recognize that if you're not connected to a placement, if you're in a placement for a short time, you're not getting your needs met. And so in order to get their needs met, we recognized that we had to create some stability. And so we connected these kids to workers that support them in that placement for up to 90 days. And what that looks like is we have to create agency so that kids feel hopeful that they can achieve those goals. And those workers are alongside them, alongside that caregiver, creating that agency, creating small attainable goals so that those kids feel connected to their community. They feel connected to their caregiver. They recognize their own strengths in hopes that they can transition to a lesser restrictive setting and hopefully home. Because again, the goal is to get them home.
Going back to what you said a minute ago, explain a little bit the difference between paid placement versus non-paid placement. So you mentioned like someone in the family or someone, what's the difference there for somebody who's not really in the space?
So a paid placement would be a foster home, a general residential operation, or a residential treatment center, or an emergency shelter. The removals come to us, and a lot of kids need a placement immediately. And so we know that we have to look for a foster home, a residential treatment center, or a general residential operation to immediately care for them. We also know that we have to look for family members to care for them as well. So we're trying to triage the situation in a number of ways so that kid feels immediately cared for and immediately safe.
And their needs are being met. That's a big shift. So essentially what you're saying is it's shifting from, we were a foster home several years ago. We had a caseworker within our agency caseworker. We had a DFPS caseworker So essentially what you're saying now is we would have a family, if it is a foster home placement, you would have a Texans Together caseworker and your agency caseworker. So the DFPS kind of caseworker that's managing that has essentially stepped away, and Texans Together is stepping into that part of the system. Is
right.
That an okay way to say that?
Yeah, absolutely. The other thing that we thought was important is that not only do you have to partner with the community and partner with kids and families, you need to partner with DFPS. They need to feel supported to move this work forward. So that was also a focus of stage one.
Yeah, and this is a big change, right? What are you hoping? I'll say, what do you feel like are going to be the challenges? A lot of people, would say especially those who don't like change, would say there's no way that something like this is going to work. Why try? And so what do you think are the legitimate challenges to something like this? And then what's your hope in what you can accomplish on the other side of that?
Well, I think some of the challenges building is organization. Clearly the philosophy I don't think has changed much between the way that DFPS or Child Protective Services would approach getting kids home. They focus on permanency, they focus on safety, they focus on well-being, but so does just about every other child welfare organization across the world.
Yeah, that's the hope.
But you have to build an organization to make that work. And you're moving expertise from one organization into another. There's a whole culture that needs to be built around that. And the processes, the policy, those can look very similar. The outcomes are certainly still the same. But the difference is that you build an organization, you have an opportunity to instill the culture that you're looking for, and you have the opportunity to change some things in a substantive way that keeps people's focus on the key outcome, which is getting kids home.
Yeah.
That can be a big challenge. There's not a lot of people around who can build big, complicated organizations on a short timeline. And there are some nuances with who are you going to have to do the work. You have to recruit them from an existing organization that continues to do the work while you're recruiting them over. So while Texans Together may grow in size and expertise, we generally drain that from the CPS workers that are still working the cases. And so that's a delicate balance. And when Shaun talked about working with DFPS and collaborating with them and really partnering with them, that's a big part of that. We can't lose our focus so that it becomes a win-loss for organizations versus families. That won't play.
Yeah. And just, earlier this month on May 1st is when we officially launched into phase one. What's your main focus right now?
Really placement stability for our kids, making sure that when they come into care, that they have a good landing spot, that they immediately feel supported. Another focus, again, is partnering with DFPS so that there is continuous service. There shouldn't be any gaps. As a matter of fact, we should be in a place now where we're plugging those gaps. And so wherever they can't do the things that they need to do, we need to stand in the gap for them. We need to help them because what ultimately helping them helps children and families.
Right.
Yeah. What is the role now for CPS? So we mentioned that CPS is now not on the placement and case management side of it, but we're still working in tandem with DFPS. So how has that role shifted, just to give some clarity there?
So there are each kid will still have a DFPS caseworker that's responsible for seeing them every month. That caseworkers are still responsible for going to court. They're still responsible for the majority of the service delivery. Where we differ is that we are supporting that service delivery. If there are community resources that we have, we make sure to offer those community resources. For example, we had a kiddo go to placement the other day. We found a placement for him very quickly, but we knew that placement immediately needed support. Reading the child's background and psychological, it was said that he needed a weighted blanket. So our team immediately reached out to get that weighted blanket. We didn't have to wait on a 2054 or any other mechanism to get it done. And so those things can happen pretty quickly. And those are some of the differences in the system.
Yeah. So it kind of brings the entire community, like you said, into the service delivery and getting kids placed and cared for and supported really well. Yeah. Brock, what would you say in terms of what you're really focused on right now at the beginning of phase one?
Well, I agree with Sean. The execution is, finding placements for youth. And when you think about it from a procedural perspective, kids come into care, they have to have a place to go. And so we've been really intentionally focused on building our placement network to make sure that we have the capacity to accommodate all the youth that need a place. We built out the intake and placement team first. We had them trained, we had them ready, we had processes in place far earlier than May the 1st. We even did some stress testing about how that would work because we wanted it to be seamless. You've got to get kids into safe environments and safe placements so that they can focus on healing and focus on improving their well-being. Mm-hmm. At that point, once you've got everything settled up where you've got your food, your shelter, you've got a connection with someone, then you've got an opportunity to start to build that well-being. And the well-being is a fundamental piece. If you can't improve that, it's going to be hard to get kids home. And it doesn't just apply to kids. It applies to the caregivers. And in our case, we think it also applies to staff. It's not exactly comparable at all to think that a person who's been working for the state for 16 or more years now has to change and go to work for another organization. You can't compare that to abuse and neglect, but you can in a metaphysical kind of way to think about that's a loss. And people react to loss the same way. It's not my choice. These are things that are happening to me that are really out of my control, and now I have to accommodate this. And, I don't know Brock, and maybe I don't know Sean, and what am I going to do over there, and how different is that going to be, and am I still going to be whole when I go through this, and this is what I have to do the work that I love. You want to be able to take care of those people. You want to make sure that they have a safe place. You want to make sure that they're connected to us. You want to make sure that we're focused on their well-being so that they can be their best for kids and families and get kids home.
Yeah. Yeah, we talk about often that healthy systems include healthy people.
Sure.
And that's not just healthy kids is not what we're after. We are after healthy, flourishing children in our community, but that comes with healthy caregivers, like you said, and healthy caseworkers. And we use a lot of that kind of ecosystem gardening, language of everyone, every piece of it, the soil, every part of it has to be healthy. And when it's not, we all have a responsibility to find out why that's happening and get back to health. Yeah, that's interesting. Super, super helpful. I want to go back a little bit to the community piece that Sean, that you brought up, the role of the community outside of, maybe caseworkers and, agency staff, but what is the role of the rest of the community outside? At Riverside, we're constantly, what can a business do? What can a church do? What can all these other people who have a place along the river, what role do they have in this new kind of system that we're in?
So we actually have a really great community building team, and they partner with so many people. I try to get a grasp on how many people they're connected to, and I think it's endless. But they partner with so many people, so many entities in the community that are willing to help, people that you just never knew would be willing to help. And so whenever there is a need, we just state the need and it happens, right? For example, we had a kiddo who wanted to be placed with grandma. Grandma needed a bed. Grandma needed to be connected to the food pantry. Those things happened in a day's time. And it's because that community building team is out there pounding the pavement, talking to people, talking to businesses, talking to churches. And again, they're so connected to so many different people that things happen for these children and families.
Yeah, that's great. That's super helpful. What is your hope, with all of this kind of coming together, what is your hope 5 to 10 years down the road? So if everything goes kind of according to plan, right, that we're able to make this transition, caseworkers are healthy, caregivers are healthy, kids are getting into either back home or they're getting into secure placements. What is your hope for the system in 5 years?
I think that I know this for sure. When I was with the state, we used to have a saying that the outcomes for Texans children is going to look like the outcomes for those in Houston. Houston had at the time the highest population of youth in care, and the outcomes for those kids really drove the state average. And your state average has to be high enough to get federal funding. And so it's important to take a look at how your system performs, because it affects the kind of funding that you can pull down from your partners. Mm-hmm. And now we're number 2 to Bexar County, but it's very close. And I think that everything that we can do to improve outcomes in Houston is going to improve outcomes for the state and for Texans Together in particular. I want us to be a healthy, high-functioning child welfare organization that gets kids home timely, that gets them home and improves their well-being and makes sure that they don't come back into care. But I want to, hopefully we'll be able to add the capacity to really focus on prevention, to stop kids from coming into care, because foster care is an artificial sort of stopgap thing that happens to people that really reach a far end of crisis. And it's an unnatural state, and kids don't belong in foster care. They belong back home with their families, or a kinship family, or an unrelated adoptive family, but everybody needs to be connected to somebody. And we have a high rate of youth who don't get that permanency outcome, and they graduate from foster care at 18. And I think that we really want to spend some time prioritizing that population so that they're prepared when they leave foster care to go make their own homes. And I think that there's work to be done there. I think that's it's not an overlooked population, but it's one of my projects is to really focus there and make sure that we can stop that from happening, that we get them connected to someone. But if they do have to go out on their own, I want to make sure that they can go out and make their own home.
That's good. Shaun, anything from you?
Yeah, I in 5 to 10 years, I would love that we have a workforce that recognizes that progress for families isn't linear, that there are so many things that we are asking families to do, and that if we are patient with those families, again, if we invest in those families, then the system does change. If we center families and center children, the system can change. Yeah. And that's really what I hope the workforce becomes. I think that, metrics and, other, types of litigation, those sorts of things kind of get in the way of creating humanity and centering families. And I really hope that this thing turns in a way that we're able to recognize people's humanity and understand that just because this thing happened to this family, that they can improve, they can rehabilitate themselves, and we're responsible. We owe it to them to help them do that.
Yeah, and the effects of that in I think sometimes we think about this kind of child welfare and family welfare as this siloed system, but it actually has far-reaching effects in our economy and public safety and just the overall thriving of any community. I know from Riverside, that's just a huge hope, is that we actually see not just child welfare thrive, although that is our main focus, but it actually, the effect of that is a really healthy city and a place where everyone wants to live, right? Yeah. So if listeners were to walk away from this conversation just remembering one thing about community-based care and this new system in Houston, what would you want them to understand?
I think I would follow up on Shaun's vision and a little bit about what you were talking about, Amber. I hope that people walk away from this thinking, this is not a Texans Together, we're going to fix it thing. We are one of many partners that focus on improving well-being for caregivers, for children, for everyone, so that they can become thriving participants and contributors to the community too. the necessary conditions for success go beyond what you can do for a particular person or a caregiver or a child. It has to be opportunity for people. There have to be environmental circumstances that allow people the opportunity to continue to improve and thrive. And those aren't equally distributed across our strata. But if we recognize that people need help, that's why they're here. They're not fundamentally flawed. There are many reasons why people slip into foster care. And it's not because the people are broken. It's because they need some help. And if we approach this from a let's help sort of framework, I think that that's going to engender the right outcomes for everybody.
Yeah, agreed. Shaun, anything you would say?
I want people to walk away with understanding that the removal is just a really small part of the story, and that is not all that we do. That is not all that this system is comprised of. This system is made up of people that genuinely care about children and families, that are invested in this work, and that don't let the negative outweigh the positive. There are so many people that genuinely care. We had a staff member that we hired, and during her interview, while we were so excited about offering her the job, I could tell she was hesitant. And I asked her, I said, I just saw something in her face. I said, tell me what you're thinking right now. She says, I don't want to give up my state phone because it has so many numbers of kids and families that I'm connected to. That was so powerful. One, I knew that we had to hire her, but that is not a unique feeling. That feeling, there's so many staff that feel that way at DFPS and at Texans Together. And so I want people to know that there are people like that want to stay in relationship with children and families well past the point of intervention. We care and we're invested in this work.
Yeah. We say all the time, how blessed we are to live in a city where there are so many people who care, so many resources available, and yet, sometimes it's just the gap is just the connection and getting the accessibility to those things. Living in a city like Houston where we have lots of resources doesn't mean that there are certain areas of the city that lack those resources and the accessibility more than others, but it is a major privilege to live in a city where resources are available, and we just get to connect the dots in many ways, So again, you guys just started May 1st with launch. Do you have any, I know it's only been a few weeks, but any stories that stand out to you as success?
We had a large sibling group that we were able to place in the same foster home, which is sometimes unheard of. But that was, it happened in an instant, quite honestly. It was late one night. It was probably close to midnight. These kids came in. They needed somewhere to go, and we were able to get them all in the same foster home. And again, I'm sure, anybody who has siblings knows how important it is to stay connected. So getting them together was really important. So I would say that was one of our first successes. And I think that happened on May 1st. So we literally hit the ground running.
Win. That's what you want.
Yeah.
Yeah, that's amazing. That's always a win when you can keep the family together. Brock, anything that pops out to you?
Well, we've had some struggles with child without placement, but not many. And most of those have only been brief instances, and we found really good homes for those kids. And those kids had some particular problems, and they're hard to place. But I was really proud of the way that the teams responded. We have had just in I guess it's been 21 days now, some late nights and some weekends, which is endemic to the work, to be sure. But everybody's responded well. We've got great partners. Isaiah House has been a great partner for us. That's where we had looked after our youth that didn't have placement. We had one young man there for about a week, but we found a place for him, I think, late last night or today, and we think that we're going to get him into a kinship placement too. And so he has some medical complexities, but we're going to find the right spot for him. And I tell the team, I tell Shaun too, I say, I'll live with a couple of hours or a couple of days of children and child watch if we can get a youth to the right place to the right place that they're going to stay. I'd rather get it right the first time than find some stopgap measure and then have to move them again.
Yeah.
So I think that's the way that we're going to approach it, and we'll take a hit on our metrics, but I think if the quality of the work is improved by that, that's what we're going to stick to.
Yeah. You're looking at the long-term success rather than the short-term metric. Yeah. Kind of last question is before we move into the last 5, but what do you guys need right now? What's your biggest need from the community, just internally, but what do you feel like is their biggest need at this moment in this transition?
I would say maybe collaboration. And, honestly, if we're doing something great, we want to hear it. If we're doing something not so great, we want to hear it because that's how we get better. So, collaboration and feedback.
Yeah, that's good.
Yeah, I really can't add to that. I was thinking the same thing. And one of the priorities that we've been working on, even previous to stage 1 readiness and throughout readiness and now getting into stage 2, are our communication efforts and reaching out to all of our community partners, our judicial partners, our provider partners, our medical partners, our school partners, everybody that we can reach out to. We do quite a bit of communications. And the reason why we're doing that is we want to form good relationships and understand their perspective of how Texans Together is operationalizing community-based care here in their community. And partly to form relationships with folks. We need some grace. We're going to make some mistakes. And, some folks are on board with CBC and some folks aren't, and that's fine. But at the end of the day, we want to form good partnerships so that we can have good outcomes for children and families. And we need those partnerships. And so anybody out there who's listening, you can call me anytime. I'm willing to listen.
Yeah. Those trusted relationships, we say a lot that is kind of the soil of the ecosystem. If you don't have it, nothing's going to grow. So you have to have those trusted relationships where there's a feedback both ways. So yeah, we definitely agree. Well, we always do a last 5 at the end that are a little bit more personal questions, just to kind of get to know who you are outside of the nitty-gritty of just the system conversation. So I want to start off by asking, what's one thing that people would be surprised to learn about you outside of work? One we already learned about from Brock, that a 6 Sigma black belt has nothing to do with fighting. So that was news to me.
Well, yeah, a lot of people key on that. Now I know why. I'm glad we discussed it. I have a PhD, but I don't advertise it. You introduced me as Dr. Boudreau, and only my mother does that, and you, I guess. But when I was a young man, I grew up in a very small town in South Texas, and I always wanted to be a cowboy. And I was very fortunate early in my youth to make a living as a cowboy, and I rode bulls and broncs for about 7 years. And people look at me today and they just can't believe it. But and it's unfortunate that even at this age, I still go back to it, right? And make sure everybody knows it. So yeah, I guess that's one piece of it.
That's so. I mean, if you grew up in a small town in South Texas, what else are you going to do?
Then it makes sense.
It does.
But if you met me today, you'd say, I don't know, this guy. I don't believe he's a PhD for one, and I'm damn sure he never rode bulls.
That's awesome. Shaun, what about you? I want to say that I might have asked you this the last time you were on the podcast.
Yeah, and I can't remember what I said.
I feel like it was singing. Was it singing?
Yeah.
I do sing a lot.
I have to go back and fact check that on the last podcast, but I want to say it had something to do with singing.
I do sing a lot. Brock is my next door neighbor. I'm sure he's like,
man.
My gosh, please.
Man, I'm digging it, man.
But yeah, I love music, all kinds of music, constantly singing. This morning, the Who's the Boss theme song is stuck in my head now. So very random. Yes. So yeah, love things like that.
Yeah. Cool. Question number 2, what's a book, podcast, or resource that has shaped the way you think about leadership or people? Always looking for another recommendation. So
I cannot think of the name of it. It is a blue book. It is, it's essentially, it's about Carry Water. I cannot think of the name of it. Anyhow.
We'll put it in the notes if you If you track it down after the podcast,
Thank
we'll
you.
put it in there.
But essentially in the book, it's a series of lessons about like really how humans complicate things. And really when the times where you're quiet, the times where you are still, those are the things those are the times when things come to you. And again, just don't complicate things. Recognize the beauty around you. I think there was one lesson in the book where the young man, he was literally physically carrying water, and he was making it so complicated and he was so tired that he missed the lesson around him. And so I really, in moments where I get frustrated, I just try to sit still and be quiet, because I will get in my own head, and really recognize like what's going on around me. What can I learn from this, and how can we grow?
Yeah, that's good. Brock, what about you?
Well, I'm going to put in another plug in for Texans Together. I talked a little bit about building culture, and we base that on 4 different texts that we draw from to try to make the right culture of Texans Together. And one is trauma stewardship, to work with secondary trauma for staff and help them to stay healthy. Another is the culture code, which talks about high-performing teams. And another is Hope's Rising and the Science of Hope. And the last is the first 90 days in government.
That's all great.
So the 4 basic concepts from those texts really form the foundation of what we're trying to do. It's share vulnerability. When you don't know the answer, take it to your team, create enough safety so the team can participate faithfully in helping you to solve the problem, and solve the problem with purpose.
Yeah, those are so good. So helpful. What's your most used app on your phone?
Probably Waze, because I never know where I'm going. I'm very directionally challenged, so probably Waze.
Yeah, it's good. Brock?
It's the text feature. I'm an old man, so I do 2 things with that phone. I answer texts on it, and I make phone calls with it. And I'm so directionally challenged in Houston. I have an apartment across the street from DePelchin, and that's where I stay.
Okay.
I don't go anywhere. I call an Uber.
Yeah. Text. Do you prefer text or phone call?
I want a phone call, but I can't control what other people do.
Yeah, I get it. I'm the opposite of that. Like, someone's calling me,
Yes.
What are you doing?
Yeah, that's what they say. Brock, why are you calling me?
It's the world we live in now. What's your go-to meal or restaurant in the city that you'd happily recommend to anyone visiting?
Really love soup dumplings. I think we were talking about this, duck and bow.
Oh, yeah. That's it. Duck and,
Yeah, a soup dumpling is delicious. I also am a chicken McNugget girl. Give me some nuggets any day of the week.
From anywhere?
No, so that's the thing. Wendy's, I feel like, has a superior nugget just because of the coating. This is a whole thing.
There we go. Yeah.
McDonald's also has a superior nugget. Yeah, it is. It's a whole thing. But that's really it. That's like, my nugget tiers. Yeah.
Okay, I like it.
The citizens of Houston probably hate me. There's so many great places to eat, but for me, it's BB's over on Richmond. Give me a bowl of that chicken gumbo.
Okay. Yeah, the BB's by our house actually recently closed. So
I'm sorry to hear that. You have to come down to the Richmond one.
Yeah,
man.
We'll have to do that. Last one. Outside of work, what's something that you are genuinely looking forward to this year? So can't be work related. What are you looking forward to?
Vacation.
What kind of vacation? Do you have it planned?
I do. I am out of here June 18th, I think. Yeah.
Where are you going?
Aruba.
Oh, man. Jealous. Jealous. Brock?
Oh, that's news to me, because I think
he's like, did you put in your PTO request?
I'm out of here on the 21st. We'll have to figure that out. I think Aruba trumps Matagorda, but I was going to go fishing in Matagorda. That was what
Sounds like you might not be going fishing.
And we'll have to see what we can do about that. That's where I was going. I have several. This is too much information, but my family lives in San Marcos, and that's where, I used to work in Austin, and so we're small town people. I didn't think they could make the move, and every weekend is what I look forward to. I leave here Friday evening, and I go spend 42 hours in San Marcos, and I come back and spend the rest of it here at Texans Together, but that's what I look forward to, and it's just a couple days away. Every Tuesday, I start thinking 2 more nights, 2 more nights, 1 more night, 1 more night.
I love that. So you get to look forward to something every week.
Yeah.
Yeah. Well, thank you so much for spending your time with us today, but also thank you for the work that you're doing, what you're building. It is important. It is meaningful. It is building something beautiful in our city. And so I want to thank you for that. It's a privilege from Riverside to be a part of it, to continue to serve you all, and to serve our community together. So thanks again for being here, and thank you for what you do.
Thank you.
Thank you for having us.
To those listening, we hope these conversations have inspired you to find your place along the river. And we welcome you to join us in bringing hope and renewal to the city of Houston. If you'd like more information on how to get involved, please visit riversideproject.org and submit a contact form. We'll see you next time.